Hi everyone, this is Dr.RUkmani Choudhary and you're watching Everyday Health SL by Dr.RUkmani Choudhary. My today's topic is Cysticercosis. It is a kind of parasitic infection and we'll talk about everything, the types, common causes of cysticercosis, homeopathic medicine, allopathic mode of treatment, prevention part. To watch complete video for complete information. If you're watching first time, please like, share and subscribe my channel for further notification. With the cysticercosis is a parasitic infection that is Taenia solium, the pork parasite Taenia solium infection. Once you ingest the contaminated food, contaminated water, and you have Taenia solium eggs. So these eggs can cause they hatch in your intestine and they convert into larvae and they form cyst, and this is how they spread to all over body and they get deposited in different types of the tissue. They get deposited in brain, muscles, cardiac, eyes. Whenever they deposited in the nerves, then these are called like Neurocysticercosis. If they are in the skin, then this is called cutaneous cysticercosis. It's a spread. What is the route of transmission? Or it's not contagious. It doesn't spread by human to human contact. No, it's not contagious. This is only spread while ingesting the egg form of the Taenia solium, the pork parasite Taenia solium. Only the egg form, not the adult form. You ingest the egg form. Is it common? It's extremely rare. It's not as common. It is extremely rare. Only found when you have travel history to rural areas or in rural areas. It's a two type of common Taenia solium infection. One is teniasis, that is through the adult form of the Taenia, and the other, this is like cysticercosis. This is through the egg form of the Taenia solium. Agent is obviously the egg form of the Taenia solium. It is through contaminated water, contaminated food, and having the egg form in any way, like fecal matter, through your hands. You can get or anyone can get this infection at any age group, but the common age bracket, that is from 10 to 40 years. Clinical cases are found of 10 to 40 years of the age. Symptoms, at times it goes asymptomatic in your body and you don't even know that you're having, for years you have these cysts and there are no symptoms. But once they disguise to your immune system, and once they start dying, so system recognizes them as an invader and start working. So there is an inflammation, and once these cysts are they get collected, or obviously there is a pressure to particular organ. If they are in the brain, then they compress the brain tissues and you have the symptom like you have headache, there are seizures, epilepsy, right? So if these cysts are in your brain tissue or your nervous system, then these are called cysticercosis. And if these cysts are subcutaneous cysticercosis, and once they are in eyes, so the ophthalmic cystis. Name is given wherever the cyst get deposited, and once the cyst they are not ruptured, there are no symptoms. But once they start dying, obviously there is an activation of immune system and there is an inflammation, these kind of symptoms. And the commonest one is neurocysticercosis. The headache, stiff neck, persistent headache, and convulsions, epilepsy, fits, or if these are in your eyes, you have ophthalmic one. In that you have inflammation in your eyes, blurring of vision, uveitis, retinitis, and bulging of your eye. Diagnosis part: how we diagnose a case of cysticercosis and what are the tests required. At times it goes asymptomatic, and at times you have symptoms. So there are certain criteria, that there is a physical examination, and there is a travel history and a blood test. So blood tests are done to finding the antibodies or antigens of Taenia solium, and even a lumbar puncture is done. CSF study is done that you are having antibodies or antigens in CSF, cerebrospinal fluid, and the eye examination is done, and CT scan and MRIs are done to scan the cyst of Taenia solium through the imaging test. So times biopsy is done when there is a visible cyst are found, visible lumps are found under your skin. So biopsy can. Prevention part. While focusing on the prevention, we should always keep in mind that what are the causes behind this. What are the causes behind cysticercosis? So it gets spread through the contaminated food or contaminated water. So just use treated water and have washed fruits and vegetables, so there is no chance of having contamination, and wash your hand frequently. So if there is due to any reason, if you have any contaminated matter of the tinea solium, so just frequent wash your hand. And inflammation, so in allopathy you are given corticosteroid to reduce that body inflammation, and as this has seizures, epilepsy, so you are given drugs, anti-epileptic. Firstly, it is a parasitic infection, so you are given anti-parasitic, albendazole. So these are the lines of treatment in allopathy. In homeopathy, yes, diagnosis do matter, but we focus on your symptoms. Your symptoms matter a lot in homeopathy, so we collect your all symptoms, means totality of the symptoms, and accordingly we prescribe you medications. So having certain medication, but these are not the limited one. It depends on your case. So you can even have different medicine. These are the general one, some general indicated one. Ruta in homeopathy is given when you have, there are cyst formation, there are node formation. So Ruta has a property of this dissolve the cyst. So Ruta is given, and this is the clinical form. You can even buy smaller quantity, and the color changes with the company. So you may have different company, you may have different color, and even the different form. So just focus on the medicine name and indication. All medicines links are given in description box below. You can buy medicine from there and you can start with one. And the dropper you can use with the help of dropper, just 1 or 2 drops 2 or 3 times in a day before having your meal. So Artemisia vulgaris is given in convulsions or seizures or fits cases where there is no aura. So you have all these things, and there are, there is a paralysis and there are convulsions. So all these symptoms are covered up with Artemisia vulgaris, particularly Phos. Calcarea, Phos and Ruta are clinically proven for all Neurocysticercosis cases or Cysticercosis cases. So these both work amazing. They are proven clinically. So Calcarea, Phos, again this dissolves the cyst, this dissolves the any kind of sac formation. So you can use Calcarea, Phos. Cinna in homeopathy, you must have heard about cinna in worm cases. Cinna is pretty common in all kind of worms, and particularly in the the children. So cinna works amazing in all parasitic infections. Cinna in 30 or 200 potency with the help of dropper, 1 or 2 drops. Cinna has canine hunger. Cinna. So you can take cinna, 1 or 2 drops, 2 or 3 times. Take with German homeopathic medicine. In cases when you have fits, there is epilepsy and there are seizures and stiffness of neck and nausea, vomiting. There can be other medicine, obviously according to your case. And all medicines links are given in description box below. So hopefully this video can give you some amount of help. If you find this video knowledgeable, and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep supporting. Thank you so much. Thank you.